watching this video 10 years ago, the news about the progression of your diabetes would have been very different. We would have been saying that diabetes is a lifelong condition and it can be managed with a healthy lifestyle and with medication, but it's not something that you can change about yourself. But now that news has changed and we've got something really exciting to tell you. We know now, thanks to some research done by Professor Roy Taylor, that it is possible to put your type 2 diabetes into remission. Some research was done with 2 GP practices that put people on a very low calorie diet. That's 800 calories a day. And people found that after 8 to 20 weeks, some participants within the study, their diabetes was actually going into remission. And by that we mean going below that diagnosis point of a HbA1c of 48. And with that comes tremendous benefits. They could reduce their diabetic medications. They could reduce their blood pressure medications. The risk of long-term complications was greatly reduced, and they were feeling much better. When researchers looked in detail at the results, they found a real link between the amount of weight that people lost and the likelihood of them going into remission. And the kind of magic point seemed to be losing 10 to 15 kilograms. This research is still continuing. It's called the DIRECT trial, if you want to look up more information about it. And people are managing, with a lot of support, to sustain these changes and sustain the remission. You might be thinking, is remission then a cure? Does that mean that I could potentially get rid of my type 2 diabetes? And it's really important to remember that remission doesn't mean the same as getting rid of it for good. The critical point is losing that weight around our middles. So losing what we call the visceral fat, the fat inside around our organs, around our pancreas and our liver, because that's what stops those two organs from working properly and controlling our blood sugars. Remember that the pancreas is what produces the insulin, that hormone that is so important in helping the blood glucose get into the cells and therefore keeping the levels of sugar in our blood down. So if you were to embark on this diet, successfully get your HbA1c below that diagnosis point of 48, you'd need to sustain those lifestyle factors, the exercise and the healthy eating, to be able to stay in remission. But it is possible for some people. And remember, the benefits are vast, coming off your diabetes medication, coming off your blood pressure medication, or at least reducing that. If you have other lifestyle conditions, you may be able to reduce your medication relating to those. Most people are finding that they're sleeping better as the weight comes off. They feel more active, they feel better about themselves, and their mental well-being improves. So there's benefits way beyond the HbA1c. If you'd like to try this, then we'd encourage you first to go and have a chat with your GP or practice nurse. It's really important because they know your medical background well, that you're eligible to go on this diet. But if you are, there's a lot of resources out there to help you. Diabetes UK, you can find them on diabetes.org.uk on the internet, have some really good resources. And you'll probably have found 800 calorie diets out there authored by a range of people. So if you want to give that a go, it might be really worth thinking about. What we found out as well from our experience of supporting patients through this kind of diet is that psychological support is really important because it's a big lifestyle change. So make sure that you've got a team around you who will support you.